So the common screening tests, a screening test is something that detects a cancer early. It also needs to have an effect in that we will have an effective treatment once we detect the cancer early. So for women, the common screening tests that we recommend are one for breast cancer, a mammography. When to do the mammography is a little bit controversial based on which country we live in. But overall, I think that anybody who is the age of 45 and above should get a mammogram done. It is important to remember that doing one mammogram is not enough, and mammographies have to be done sequentially. So every year, if you get the mammogram done, the chances of detecting the breast cancer in an early stage are higher. In addition to this, we also recommend that all women do a self breast exam. The reason for this is that we become more aware of having breasts and that it is an organ that is prone to cancer, and it's a common cancer that we see in India. So by doing self breast exams, we know that this cancer exists, one thing. Second, we are also more aware of how our own breast feels like, and so if there is any difference, you will know earlier and will be able to seek care from the doctor. The best time to do a self-breast exam would be 1 or 2 days after the period is over. That's when the breasts are lightest and lumps can be palpated more easily. Also, a clinical breast exam after the age of 35 should be done by a doctor, so that any lumps, if they feel that it is suspicious, can be evaluated immediately. So to conclude, for breast cancers, self-breast examination, clinical breast exam after the age of 35 yearly once, and a mammogram after the age of 45. The other cancer where we do screening test is cervical cancer. So the cancer of the cervix also can be detected very easily by a procedure what we call a pap smear. A pap smear is where a gynecologist looks at the cervix. They do a pelvic exam, then they look at the cervix, and from the cervix the tissue is brushed and put on a slide and looked under the microscope to see if the cells are looking abnormal. A pap smear is not painful. It is a quick test that can be done, and knowing what type of abnormality is there, based on that we can decide what needs to be done next. The timing for a pap smear is we can start at the age of 30, and it also depends on the risk factors for cervix cancer. So please speak to your gynecologist on when you should be exactly having the pap smear and how often, but usually we say that it should be done once every 2 to 3 years. The third cancer where we have a good screening program is for colon cancer. Colon cancer was not very common in India in the past, but slowly the incidence is increasing both among men and women, and it forms around 6 to 8% of cancers that we see nowadays in our country. The screening test for this is a colonoscopy, which should be done at the age of 50, and after that we can repeat it once every 10 years if the colonoscopy is completely normal.